Hi, Nora. I'm just giving everyone a few minutes to log in. If everyone wants to go ahead and put where they're dialing in from in the chat, that would be great. Oh, Boston. So you're just, Jennifer, you're just getting, have you attended any of the new events yet that Boston's been having? We got a new chapter director there.
Not yet. I was supposed to go the first one, but I had a last minute work trip to Brazil, so I missed it.
Well, that's what we always say in DC. We're like, oh, well, we'd say we felt really bad, except we were in Morocco or Egypt or Brazil.
But I'm excited because I'm coming to DC in July and I'm going to try to go to the, I think it's the Lily Festival event or
The
something.
Lotus, yeah, the Lotus Lily Festival.
Yes.
So it's going to be really muggy, but I have a feeling it's still going to be really beautiful. So
yeah, I'm from that area originally and I moved away because of the mugginess to Boston, but I'm coming back for like 2 weeks to visit. So I don't mind the snow.
I moved down from upstate New York because of the snow.
It's only bothersome when it's like over 6 inches and then shoveling is cumbersome.
Yeah, I mean, that's the nice thing about DC though, right? Is it usually most of the time it might get like icy and freeze over, but it'll melt like after a day. So if you're lucky, you don't have to shovel anything at all.
Yeah, more than 2 inches and schools are closed. But I do remember like it was, I think like 1994 or something like that. And we had a blizzard that was maybe 6 or 7 inches or more. And everything was shut down for a long time.
Yeah, we had two right after I moved here. It must have been 2009. We had snowpocalypse.
Yep.
Or snowmageddon. That was a nightmare.
Drove from Boston to DC in one of those storms.
Gosh. Yeah. Hi, Debbie. Hi, Erin. Where are you guys dialing in from?
I'm in the border of British Columbia and Idaho.
Oh, lovely.
We've got grizzly bears out there this week. Oh boy.
Just say hi to them. Approach them and give them a nice hug.
Yeah, I'll stay inside.
Marinelle. And Nora, we had a fairly active Toronto chapter, just so you know. I think we might be looking for another chapter director there. We did have one for a while. So there is a wonderful contingent there, just if you had interest.
This is good to know. Unfortunately, I don't think I'm here long enough. I mean, I have a place here, but I'm almost never here. So I'm probably not a good chapter director.
Oh, well, no, I even just in joining the local in-person events too.
Got it. Great recommendation. Thank you.
All right. Well, I guess we can go ahead and get started. And this is actually the first time I'm presenting this particular presentation, so bear with me. I'll be multitasking, letting people into the room and dropping things in the chat at the same time. So you guys will have to just be patient with me as I do all of this at once. And I will go ahead and share my screen. Let me see. I just saw somebody had dropped something in the chat. Let me see. Oh, thanks, Sam. All right. All right, and can everyone see my screen without the chat and Zoom stuff in the middle of it?
Yeah.
Okay, just wanted to make sure because for me, the chat is up and I've got all my Zoom stuff at the same time. Okay, so thank you guys for joining me. Today, we're going to be talking about ethical travel in the era of COVID. what we can do to, and this is a really sensitive subject and has been for a long time, but as COVID becomes more endemic, I think it's important that we still pay attention to risks involved and how we can mitigate those risks. So I thought it would be a good idea to go ahead and put this presentation together and hopefully answer any questions anyone might have along the way. We do have a couple of individuals dialing in that are not current wonderful members. And before we get started, just some wonderful announcements real quick. We are actively looking for volunteer members. You can apply today as a volunteer, and I'll go ahead and drop that link in, and you can get a free membership if you do so. We have open membership month through June 15th, where you can get 30 days free. And I shall drop that also. And that goes through June 15th. So if you register for it on June 15th, you still get 30 days free from that date. And if you stay through the end of this presentation with me, you can grab a promo code for up to $100 off your next hotel stay. So definitely stay through the end with me. There are a few can't miss events coming up. This Thursday evening, we have a fireside chat with Wani Spots, the first Black woman to travel to every country in the world. She's also been to every continent, so that includes Antarctica and a whole lot of territories. We actually have so far over 150 attendees that have registered for this event, so you'll definitely want to be there. We also have the follow-up presentation to this event, which is everything you need to know about international travel during COVID. So while we'll talk about ethics in this ethical travel in this session, we're going to talk about all kinds of testing, how to find information between countries, making connections, common pitfalls while traveling. So you'll definitely want to be there for that. And just coming off of the heels of the Women in Travel Summit in KC and announcing that next year's North America WITS is going to be in Puerto Rico, we are reminding everyone that we still have our Women in Travel Summit in Gdansk this October. So just so everyone knows that a portion of your membership goes to a different travel organization each month. So we donate to a different beneficiary every month. This month is Hi USA. You can read all about their programs at their website. And for every paid membership, a wonderful scholarship goes to a woman in need. So if you know someone who would be interested in it, they can just go to wonderful.com/scholarships. And applications are accepted on a rolling basis. The next acceptance round is June 30th, so really soon. So I'd encourage people to sign up for the 30 days at /open and then apply for a scholarship if they like. And of course, a big thank you to all of our brand partners who help make all of these presentations possible. And now your feature presentation. Let's go ahead and get started. All right, ethical travel in the era of COVID, presented by me, Jordan Campbell of Global Debauchery. When we're done, you're going to know a little bit more about me. You're going to know some differing perspectives on travel during COVID. And to be fair, I'm putting everything out there. They are not necessarily my opinions, but they are things that people have said, people have feel, they're differing views just for you to chew on. I'm going to talk about some things to consider if you're considering traveling right now, and how we can travel more ethically should we do so, resources to help you determine if travel is right for you right now, and more info on the follow-up session, everything you need to know about international travel right now. So about me, my name is Jordan. I live to help people travel deeper. I'm a travel blogger behind Global Debauchery. I'm a third culture kid currently based in DC. I am a flashbacking road tripper. I'm all about offbeat misadventures and dark tourism. I visited 53 countries in all 50 states, and I always like to have a drink in hand with me along the way. Let me see if I can mute someone. I'm getting oh, okay. I think they've muted. So you might know me from Wonderful, where I'm the membership director. I'm also the DC chapter director. I've spoken at the Travel Adventure Show, and I've done presentations for Nomadic Network as well. You can follow me at Global Debauchery, and you can subscribe to my newsletter. Let me add that. Either in the right-hand sidebar or on the pop-up. for travel inspo and fun discounts. All right, so I'm starting this talk with just a couple of disclaimers before we dive in. This tends to be a hot topic, so everyone, let's keep it cute. Everyone's got varying levels of comfortability. We need to respect these differing viewpoints. Up front, I'm not here to persuade anyone to believe one thing or another. I just want to provide perspectives and resources so you can make up your mind as to travel is right for you. I do encourage, that being said, I do encourage everyone to be thoughtful about travel right now. And full disclosure, because I think it's important going into this conversation that you guys know a little bit about my background and where some of this is coming from, because we're all biased, right, in a certain way. I am not a medical professional. I have traveled extensively internationally during the pandemic, but when in doubt, ask your physician, of course. My personal views have changed over the last couple of years as the virus changes. That's okay. They're going to continue to as we learn more and more, and as the virus becomes more endemic. I decided to do this chat just because I believe that there are things that we can do to mitigate risk while traveling during this time. I'm US based, most of the wonderful community is, but most of the information I'm going to be sharing is focused on US. I've included some UK items in there as well. When the pandemic first hit, my state did implement full stay-at-home orders for 4 months. So I am not in a place or from the background of where nothing was going on in the world while this was happening. I'm fully vaxxed, boosted, coming up on getting my 4th. I do have an autoimmune illness. I've managed to stay COVID-free during this time, fingers crossed. But so staying healthy and being able to do what I love has been really important and a very careful balance for me. I actually just went on a trip to Morocco, and my father, who was in his mid-60s, did test positive coming back through Portugal. So we went through that and all of the hoops that you have to jump through to get back home. And I have, again, full disclosure, I have actively traveled internationally since the start of the pandemic. So I think someone, again, is microwaving something. It's not muted, so let me find you. Okay. So to start, a quote from Jane Goodall: you cannot get through a single day without having an impact on the world around you. What you do makes a difference, and you have to decide what kind of difference you want to make. So, and here we go with some of these perspectives. Some people believe, and this is the short version, right? There's a lot more to it and a lot more layers. There's no stopping COVID. There never was any stopping COVID. That's one of the viewpoints. Travel should have never stopped. COVID is what it is. It's going to spread anyways. There was the perspective not to restrict the many for the few. It's an infringement on the many. And the biggest one I've heard is that the tourism industry needs our support. It's vital to a lot of economies around the world. Other people believe, again, in a nutshell, very high level, travel right now at all is completely, totally unethical, period. It's a privilege, not a right, and we all need to recognize our privilege. And my individual actions can save lives, and we need all hands on deck in order to save more lives. Lives are more important than economies. The rest is details. Has anyone else heard any other particular viewpoints that I've missed? I feel like this is very, again, very high level and sort of very generalized, but wondered if I missed any major ones.
It feels like either, there's just two sides to it, honestly.
Yeah, I think, yeah. And again, they're very multi-layered, and it's very much like, well, this person says this, another person says this. I do believe in all of this, that we can still travel responsibly. And here's some food for thought. So, and this is a lot to take in, but, and again, very US based. So to date, only 67% of the United States is fully vaccinated. I think the reason I brought some of these up is because I think it's important to actually really put things in perspective for everyone. A lot of folks that I talk to are very shocked by some of these statistics about the United States in the midst of the pandemic. Some of us are not, but I have talked to a lot of folks who are very surprised. So technically, I don't know what the combination of people who've been infected versus 67% that is fully vaccinated, but based on vaccinations, technically we are not at herd immunity still after all this time. It's important to note that while the United States is doing what it is that we're doing, less than 66% of the world has received one dose. Less than 16% of people in low-income countries have received one dose. The US is actually ranked around, depending on if you're looking at countries, territories, et cetera, number 66 in the world for being fully vaccinated. And UK is around number 42. So when you think of our daily lives going about living how we're living, and you think about the rest of the world, I mean, we're not, really, just things keep in perspective. We're not really winning that competition from the US point of view. The US has the most COVID deaths in the world. As we know, we reached 1 million deaths just a few days ago. Brazil and India respectively have about 666K and 524K respectively. So the next country with the largest amount of deaths from the United States still has 350K fewer deaths than the United States does. So again, just to keep things in perspective, as a percentage of the population, so numbers aside, based on population, US COVID deaths still rank around number 19 in the world, around number 31 in the world for the UK. Fully vaccinated individuals are 2/3 less likely to be hospitalized. This has been proven over and over again, even right here in DC. They were noting at the onset of Omicron that I believe it was less than 5% of hospitalizations were coming from vaccinated folks during Omicron. There was a big surge, but it is very unlikely if you do get a breakthrough case that you're going to be hospitalized as a result of it. And one thing that I know concerns a lot of travelers is airplane air. How healthy is it to be trapped in an airplane in a small space for a number of hours, sitting directly next to a stranger? I will say that there have been a lot of studies done on this as well. 40% of airplane air is filtered, 60% is actually fresh from the outside. It is HEPA filtered. So you could think that in a way it's safer than being in a grocery store with somebody, but for the fact that you're sitting next to somebody for hours on end, right? I'm just looking at Sam's comment. We've heard a lot of talk about irresponsibility of travelers coming from high income, high vaccine access countries and going to places with significantly lower vaccine access. Yeah, absolutely. And we will touch base on that. And Carrie, yeah, we'll also touch base on the airport over the airplanes too. So, the question really is, what do we do with all this information and information like it? So I think these are questions worth asking when we're touching all of this, and you have to be honest with yourself. And some of this is going to seem very, obvious for a lot of us, but it might not be obvious for other folks, but it's still worth definitely taking into account. And in the next slide, I will tell you why these are questions worth asking as well. So not just for you, but for others around you. Am I vaccinated? Am I boosted? When was my last booster? What else am I doing to prevent the spread of infection just outside of getting boosted? Is the country I'm traveling to more or less vulnerable than my own? And we'll talk about that as well. That comes to be a sort of responsibility question and what kind of risk you're willing to take. And are you willing to impose on the healthcare system of another country, the country that you're visiting? Does my health insurance cover me internationally? And of course, can I afford my own expenses if I test positive abroad? And why do these questions matter? How do they relate to ethical travel? So, for personal selfish reasons, you want to know the exact time you got your last booster because some countries require vaccinations within period X. In other words, don't go get your third and assume you're all good. If your third was more than a year ago or 9 months ago, some countries require it within a specific time frame afterwards. So you might have to go get a fourth, or you might have to go get your first booster. Also, though, in general, of course, we don't want to contribute to infection rates. More and more studies are just coming out that while you can get breakthrough infections, you are less likely to be severely sick with vaccinations. Just because country S doesn't require masking or distancing doesn't mean you still shouldn't do it. A perfect example of this is Morocco, where we visited, and people were really casual with masking. No one was really wearing masks unless you were inside, and they were, for example, hospitality workers. You would walk around in the Medinas, tight spaces, outdoors, but tight spaces nonetheless. And a lot of people were not masking up, but it's important to remember that just because it's really easy to get out of the habit, doesn't mean you shouldn't be doing it, and try to distance yourself as much as possible. If you are going to travel right now, this is if you decide to travel, consider traveling to countries where COVID resources are more accessible to everyone, not just you. In other words, do not travel. If you want to be an ethical traveler, don't travel to one of these countries that has less than a 16% vaccination rate and really has trouble accessing vaccines at all, where there might be a strain on hospital resources. In the same breath, you also don't want to underestimate or make generalizations about foreign countries' healthcare systems and whether it's adequate. I had a lot of people drop out of the Morocco trip I was running because they were worried about Omicron. Morocco had closed its borders for a short period of time, but there were comments that were made that were also just unethical comments in general, that, you know, they were concerned about healthcare resources in Morocco. When the truth of the matter is, if you go over there, you know, their cities are bustling cities, modern cities that have perfectly well qualified doctors. Now, that doesn't mean that you want to go and impose on their healthcare system, of course. So another question and why it matters, if you test positive by traveling, you're pulling resources from another individual or another society. So for example, in the United States, you know, it's easy enough to be like, oh, if I get COVID, I'm not going to die from it. And this was pre-vaccine. However, that being said, there are a lot of people who are getting very, very sick. So it's entirely possible that if you happen to get sick and you need a ventilator, you're taking that ventilator from somebody else. So it does need to be a collective responsibility, particularly while we're traveling. You know, the US has its varying viewpoints. However, that doesn't mean when we go somewhere, we should just assume that everybody else shares our viewpoints as well. About getting travel insurance and checking your own travel insurance. You might be surprised how many mainstream insurance companies do not cover international travel. And this is the small print. You know, they might not cover hospitalization. They might not cover ambulances. A lot of places don't cover like Helivac, you know, if you would need it. So you'll want to read the small print, and you'll want to get additional insurance as well. And you should note that some countries require it prior to going and visiting. And should you test positive, you need to make sure that you have the resources to basically support yourself while you're in this other country. You know, a lot of people, it can be 5 to 10 days if you test positive, depending on where you are. You're going to need to stay in the same hotel. You're going to need to afford your food. You may have change fees on your flights. So in other words, you know, be responsible about that. Don't ask someone else to foot your bill if you get sick. Make sure you have funds available, and definitely have a backup plan in place. Just checking here again. You're traveling. Yeah, that's true, Sam. And there are, yeah, there are definitely a lot of countries doing way better too. There was a question coming up about what countries have high vaccination rates as well, that I will answer coming up as well. So tips for ethical travel during COVID. Of course, get vaxxed, get boosted. We know these things. Test regularly, test before you go individually, even if your location doesn't require a test. Mask up regardless of whether everyone else is. Wash your hands, sanitize, social distance. We know all of these things. Definitely consider KN95 masks. That's the US style. FFP2s are the European equivalent of those same masks. The reason these are recommended is because they're better fitting than cloth masks, and they are more likely to keep molecules and particles contained and outside, since they're better fitting. If you're going to travel to countries whose healthcare systems have bandwidth and funds. In other words, do not go to countries who are desperately struggling already with the COVID epidemic or with their very own economic issues. That's a huge imposition and very privileged mindset. And it may even be, it could be argued, it may even be a privileged mindset to be like, oh, we're going to go somewhere else anyways and impose on their healthcare system. Definitely purchase travel insurance. Definitely have a backup plan in the event of a positive test. And it's probably best to know your destination country's COVID protocols before you depart. In other words, don't just ask about testing and how I get over there. What happens in the event that you should have a positive test? Some places require that you quarantine in specific locations. Other places let you quarantine on site and just get food delivery, things like that. Some places require that you visit a hospital after your test to get a certificate of recovery. It's all different. So wherever you decide to go, just go ahead and make sure you know what that is before you get over there. I've had, when my dad tested positive and a friend tested positive, they were both scrambling all over the place and having a lot of difficulties making international phone calls, getting in touch with embassies, things of that nature. So this is just good information to have on hand that will save you a lot of time and effort, and possibly save you from infecting other people while you're out and about. So here are some helpful resources. I'm actually going to dial into them so you guys, or log on to them. You guys can still see my screen, yeah? Okay. So the first resource that I like a lot is kayak.com's travel restrictions. And let me go ahead and pull up this link and show you. So kayak.com's travel restrictions, /travel-restrictions. So basically you can say, hey, I'm coming from here and I'd like to go to here, and you can filter all different ways, right? But the one thing that I really like about it is that it shows you the estimated percentage of the population that has been vaccinated. And it shows you at a high level if unvaccinated visitors are allowed, if vaccinated visitors are allowed. If you, for example, let's go to Argentina, where 90% of the population has been vaccinated. We can go here, and it will even tell you all about COVID-19 testing, quarantine, documents, additional resources. A lot of it too, they will direct you to, any forms you need. A lot of them want you to put passenger locator forms. You have to download apps some places. And a lot of these actually, oh yeah, Rosanna, I'll actually drop this one here, but I can also drop them in the event posting in Mighty Networks as well. And Jennifer, what's the best place to look for those details? That seems to change. Actually, Jennifer, I would recommend this site right here. A lot of times in the details, it'll give you the official, under resources, official entry requirements with the links as well. So it'll link you to the formal tourism board, the embassy, things like that. So you can get the most up-to-date information. Where's my next? The next one, CDC, of course, they have a whole section just about travel specifically during COVID. And I can share this with you as well. The World Health Organization has a whole section called Mythbusters. So and it has a lot of random stuff on there, and it has a lot of stuff with infographics, things like that, all the way down to what type of hand sanitizer I should use. So, and this is a good one. And you can actually report sites there that are sending out misinformation as well. Department of State. I always love Department of State. And actually it looks like, so this is the United States main travel site. You can search on any country by entering, this is my country. This is the main travel advisories page that it will take you to. However, that being said, here's the CDC site with all of your travel stuff, domestic, international cruise ship. You can get started. Here is the WHO Mythbusters, how to report misinformation, but all the way down to mosquitoes, medicines, hot peppers, hydroxychloroquine. And here is the Department of State page as well. So you can go right here and look up any information. This includes entry requirements, even visa requirements, local laws and customs, things to look out for, general health and safety rules as well for any destination. So say I want to go to Morocco. And here we go. And actually, I will note that when I went to this page yesterday, I noticed that the US actually decreased all of the country travel advisory levels that were initially due to COVID. They were all a level 3 or a level 4, and those have all since changed. But you can see here all of these different requirements as well. So all vaccinations, more health information. And of course, these are some of the best sites as well for whatever country it is that you're traveling to. Official tourism sites. So those always have, as opposed to, I recommend these over like the actual government sites, because official tourism sites are built to be a little more user-friendly and have a lot of things in layman's terms, whereas if you go to the government sites, they have official memos and announcements for the latest, and that's a lot of documents, almost like press releases. So visit the official tourism site for your destination. Also, if you have connections, you can check with the airline should be sending you regular emails about what you need for that specific airline. And you'll want to check the airports that you're transferring through. The airport websites have a lot of, they'll have different ones like, are you staying here? Are you just passing through? And you can click and figure out the different requirements there as well. And they are, that's exactly right, Rosanna, they're ever changing. Never doubt that a small group of thoughtful citizens can change the world. Indeed, it's the only thing that ever has. Sorry, that's my cat. She's 18. She's old. And I will say as well, so I got some questions submitted. I wanted to make sure I answered these before we jumped into questions with you all as well, just ahead of time. So someone had asked about comfortable masks for long haul flights, more practical, less ethical is what they had said. And I would definitely recommend, I would still recommend KN95s or FFP2s or FFP3s. Feeder. Because they are the safest. And it should be noted too, that they generally protect the wearer, not those around you. So there's only so much you can do to protect others who are unmasked. I do personally find that sometimes they pinch behind the ears a little bit after a while. So sometimes they actually have these almost like little hooks where you can hook either side of the ear straps onto these hooks behind your head so they don't have to stay behind your ears. If you find that they're uncomfortable in the nose, you can double mask or a surgical mask that's more comfortable underneath your KN95. Someone had asked, like Kara, I think this was you, about navigating airports with the least amount of risk. My honest advice is I would just do the standards that we know we should be doing. So obviously make sure you're vaxxed, make sure you've tested ahead of time. You know, social distance, mask up, wash your hands, and sanitize. One thing that I have thought of on flights to certain countries is that there is a little bit of comfort in knowing that at least in the general boarding area where you're at, for specific countries, that pretty much everyone has tested negative recently in order to board that flight. So there's some level of comfort there. You know, it's not a guarantee that they're not positive. Information regarding COVID protocols in other countries. So you can find those at that kayak link. You can also find it on their tourism site, on their tourism sites. And what was the other one? Oh, airport sites as well. Traveling with children who are unable to get vaccinated. So, you know, this is still a big concern where, you know, I think, again, if we're social distancing, if we're vaxxed and we're masked, there is a limited, we are reducing our own risk much, much more therefore reducing the risk of getting somebody else infected. Unfortunately, there are a lot of children who are unable to get vaccinated. And again, depending on where you go, it might be the case that everyone has tested negative in order to even board the flight. Children included down to a certain age, it might be as young as 2. Don't quote me on that. Again, I'm not a medical professional. Again, I would just use all of the standard protocols. And somebody asked about monkeypox as well, since that's been in the news. So I did actually check this up on WHO and CDC. And I thought I had read it, but I just wanted to confirm. So actually human to human transmission, even though while we have something like 80 countries now that have verified cases, is actually not super easy. It can be transmitted through large droplets, but you have to be in that person's company in a very close proximity to them for quite a while. The only other way to really get it through skin is through open wounds, scratches, and coming in contact with open infections. I think right now, we're just feeling out where it lands. I'm not sure that I'm panicking about it too much personally, but everybody has different levels of comfort. Yeah, watch the pool and the hot tubs. I mean, to be fair, Rosanna, I've gotten folliculitis from a hot tub, so I mean, you could get everyday sort of, skin infections as well from those things. So yeah, don't be jumping into any skeevy pools or hot tubs, making the same mistake. And I did want to open the floor. Are there additional questions or comments? Any thoughts here? Did I miss anything? I shall open the floor.
I think the knowing what the protocol is really important, because when I was in Brazil, I tested negative for COVID on Sunday night for my Monday night flight. And by the time I actually went to the airport for Monday night, I was just starting to feel like maybe I had a little bit of a cold, and I was, running on 0 sleep. So I was super run down. By the time I landed in Boston at noon the following day, I felt like I had the flu. I went home and I tested and I was positive. So within a day, my world changed completely. And I know one person who actually tested positive and got stuck in Brazil, positive, quarantining in her hotel, etc. So it's definitely important.
Yeah, I think you have to be prepared. And this is some of the stuff I'm going to actually cover in my follow-up chat. I just thought it was important to have this chat first between diving in and being like, everything you need to know about international travel, talk about how we can, if we're going to travel, how we're going to do it, how we can do it in the most responsible way possible. But I've known personally people who've gotten stuck. My dad got stuck in Portugal. I knew someone else who got stuck in Europe as well. A girlfriend of mine got stuck in Egypt. So it is important to know what to do and, the steps that you need to take. There's a lot of, in my experience with all of those people, there was a lot of panic, some crying, that kind of thing. But, so long as, and thankfully none of them were hospitalized. That was the other thing. And we can't guarantee that for everyone. So it is it has to be a calculated risk for you, but also taking into mind other people as well. Yes, definitely take a lot of test kits with you. Note that only certain kinds of test kits can get you back to the US. And you need to be careful which ones those are. Those have also changed over the months. And get the travel insurance plan that covers truck. Yeah, so this is good as well, what Sam was mentioning. So not all of these travel insurance cover COVID specifically. You'll want to make sure that it does, or that you have cancel for any reason, which is called, they refer to it as CFAR insurance as well. Additional comments, questions, anything? Got a quiet bunch today. Oh, Tiffany, you had something?
I put a question in the chat.
Oh, let me see. Did I miss it?
I'll just read it off.
Okay, I may have missed it. I'm sorry.
What are your thoughts on travel to India and Asia? regarding pandemic safety and what are the requirements, like the requirements when you're in the transit city? Like, for example, say if I were flying from LA to India and transit is in Singapore, like, are there any special requirements that they require? And when we're at our destination, do you recommend wearing an N95 outdoors the whole time? I know it's uncomfortable. I just was wondering what your thoughts are on that.
So specifically for traveling through Singapore and to India, I would definitely check the kayak site. And actually, let me see. Let's see here and just see what they've had, a really rough time. I'd like to say the US has had a really rough time as well with COVID, but India particularly so. I mean, my personal opinion is a little bit that the US doesn't really have much of an excuse. India generally is not as economically sound as the US is. And they've had a really difficult time battling it. However, it says here, 72% of the population has been vaccinated. So that's more than the US.
Yeah, the
But
CDC says that it's low risk traveling there.
yeah, I think the thing is their healthcare system has been overwhelmed. They're also having a lot of issues lately, of course, with the climate change stuff. But I just put in the chat for you restrictions and things like that for India. I mean, I think as much as the CDC recommends, outdoors is generally fine to not be masked up. However, if I was in a crowded area, like on a sidewalk, or again, like technically when we were in Morocco, we were outdoors, but we were in Medinas, which are really small alleys. And sure enough, my husband and I like never let up on it, even though a lot of other people were not masking. I think they just got really comfortable and kind of, it felt good and people even forgot for a short period of time. But I think just for you and for others, I would still recommend if you're just in tight spaces to go ahead and keep doing what we know we're supposed to be doing. And I saw another hand raised as well. I thought it was Tiffany's again. Nope. Okay.
I have another question. Like when you decide where you're going, and say like India, for example, and the requirement is 72 hours in advance proof of COVID negative testing, where do you upload your information to?
So that depends on the individual country that you're traveling to. Some of them have, just as an example, some countries in Europe have specific apps that they ask you to upload to. Some airlines request that you upload your results to the airline before you can fly. So I would just read as your flight emails start coming in, read them very, very thoroughly. A lot of countries will ask for, they call passenger locator forms. So there are forms basically saying, I'm staying here, I'm coming from here, and providing contact information. That's a lot for contact tracing as well. And definitely know that for the US coming back, there is a very long, it's like a 7-page form attestation coming back that, you do have to get tested within, I think, the day before coming back into the US. So not 24 hours, but the day prior, have a negative test. And you have to provide this attestation form. That's like a 7-page thing. Sometimes, I mean, in a lot of them like print too. A lot of the airlines just take the print versions of the attestations. That's important to know as well. So if you're either print it out before you leave altogether so that you have it in hand, or make sure that you have like your hotel printed out as a favor for you where you're staying.
And how do you find, like say I'm coming back from India and the requirements for entry to the US is 72-hour COVID negative proof or verification. Where do you go in India to get tested? How do you know, how do you find that out?
So a lot of times on the actual tourism board site, so if you go to the official tourism board site for India or the city that you're staying in, they'll have almost a drop down. They should have a whole COVID resource section. And a lot of them allow you to search area testing centers that are near you. They allow you to they allow you to make appointments online ahead of time. And yes, Jennifer, that definitely, if you bring a kit with you, and yep, the hotels will often help you and tell you where the closest place is. They can even make the call for you and schedule the appointment for you, so you don't have to work with the language barrier. If you bring an online testing kit with you, it is super easy. Mine literally took 15 minutes. I would say that you have to be careful that the one that you have is the right kind. So for example, I have a bunch of Abbott Industries ones, the Binax Now tests, and they're in 2 different boxes, and one box is approved to come back into the US and the other box is only a testing kit and it's not approved to come back into the US. So before you go anywhere, if you decide to do the self-testing route, I would confirm ahead of time before you leave that that particular test is one that the US accepts coming back in.
So you have the option of testing yourself. You don't necessarily have to be tested at the destination that you're traveling to.
No, you do not for the US, not if you're returning to the US.
So
But it's
you
limited.
can't just,
It's like 3 or 4 different very specific tests, and they do take time to come in. They're not, I don't believe, I've yet to confirm whether the free tests that you can just order through the postal service are ones that are, I don't believe so, because they don't have the virtual appointment that you have to make.
You can use them with certain companies. Like when I came back from Brazil, I did use one of the ones I got through the post office. But at the company that I used to proctor my test, it was one of the accepted tests. And so they had very specific tests on their website that they worked with as well.
Yeah, and so the way that you do the test, well, and it's, yes, exactly like Kara was saying, you basically do the test, conduct the test on yourself in front of the screen. Like they ask to see, it's actually really weird if you're doing it on your phone, because you have to set your phone up just right and far enough away, because they want to see you perform the test and they want to see your face and the test on the table. So you actually have to put it kind of far away. And yes, it might be 72 hours to get into India, but returning to the US, it is the day before. Not
so
72 hours.
how does that work? Because it's almost like a day to get back from India to the US. Because with the transit, it's like, I think a 16-hour plane ride and then the transit and then another couple hours.
Yeah, it just says the day before you depart. I would check, I would just double confirm on the Department of State site, that link that I sent.
So when you're traveling to a very far away destination and the time is cutting really close, like how do you plan for the testing? Do I just make an appointment at a clinic in India, or I don't know how easy it is to like get one of those US approved tests like you were saying.
I would do
How
that
available
or
they
make
are.
an appointment. A lot of the appointments that I've had for US are rapid tests. So you get your results online digitally within an hour. I think I had one that took maybe 2 hours. Even actually in Morocco, they have a service where the doctor came to our hotel and tested us and then just emailed us. So there are a variety of options. And yeah, as Jennifer was saying, it's 1 calendar day, not 24 hours. Does that make sense?
Yeah, so US's requirement is you have to do it in front of them. Like, do you have the option of getting it at a destination clinic and then forwarding your results
Yes.
to US?
Yes, you can do that.
Okay, so there's 2 options. You can do it in front
Yep.
of them if you have your own
Yep.
self-bot test, or you can upload the clinic results on the website and give it to them one day before you get there.
Yes.
Okay.
Yep. And there was another question?
I was just gonna note, it's 1 day before you get on your flight, not 1 day before you arrive in the US. So it's 1 day before you board your exit flight.
Yeah, and that's an important distinction too. So I can't I can't confirm that specifically, but I do know it's an important distinction when you're flying with other countries as well. And it's possible that you'll find like the airport will say one thing and then a destination will say another thing. So in those instances, like I had that happen when I was going to Germany, in those instances, I would really just recommend being on the safe side and trying to check both off the list at the same time.
What happens if you, like, God forbid, test positive? Like, say you're leaving India to the US on the 13th of June, or say that so you're going, your departure is the 13th, you test on the 12th and you test positive in India. So basically, do I just cancel my return flight to
Yep.
Los Angeles and I'm stuck there for 14 days, or until I'm
Yep.
negative? Until, really? Wow. See, like,
Yes.
how do you even plan going there and coming back? Do I like get tested before I buy my plane ticket to go there? Like, do I buy my plane ticket like 1 or 2 days in advance when I'm confirmed negative? And then the same thing coming back to the US? It just seems like such a monetary risk, you know what I mean?
It is, I mean, it's like I say, it's a calculated risk. So if you are going to travel, like these are the things that we have to think about when we're traveling. So I will say that since COVID started, a lot of airlines do offer changes free of charge. That depends on the airline you booked and sort of the flight plan that you booked. So that'll be between you and whatever you booked. So a lot of them have allowed, you know, if you test positive, that you can rebook your flight free of charge. Some of them do still have change fees where it would be $250. Testing positive and how long you end up staying there depends on the country. So Portugal at one point was 5 days, then it was 7 days. And it also depends a lot of times on whether you're asymptomatic or symptomatic. Every country as well has individual COVID protocols. That's why I suggest that you look into those and know what they are for your country that you're visiting before you go. So it's possible that you would have to quarantine at specific hotel locations dictated by the country. Some of them let you quarantine in place. So wherever you're staying, you can just extend your stay. And that's assuming that they have availability for you to stay that long as well. But should you choose to travel during this time, those are expenses that you need to take into consideration. That's absolutely why I recommend getting travel insurance and ensuring that that travel insurance covers COVID-related costs, because a lot of them do not right now.
Which, is there a certain insurance company that you recommend or that you know of that will cover COVID related expenses?
There are a lot of them out there. I'm wondering, can anyone recommend some of their favorites? Marinelle, if you're still on the call, I know you had a really good one that covers a lot of different things. Oh, I think Marinelle jumped off. I think you can just AIG Travel Guard. Yeah, I think CFAR is the best type of insurance to get. There's also, what is it, World Nomads? Guys, that's a pretty common one that a lot of folks use, that you can purchase different levels.
CFAR spelled with an S or a C?
Oh, C, cancel for any reason. So
Cancel
just
for any
capital C, capital FAR.
Okay.
And just medically speaking, depending on your insurance in the United States, you may or may not be covered medically abroad. Like, I always check with my insurance on the particular country that I'm visiting what is and is not covered, so that I know for that specific location, at least medically speaking, not canceling or changing flights or anything like that, what I'm getting myself into.
So what specifically do we want to make sure is covered when we purchase travel insurance during the pandemic?
I mean, it's whatever you need. I would make sure specifically that it covers COVID related expenses, COVID medical expenses. Like I said, a lot of them don't. So the next best thing is to go for the cancel for any reason type of insurance. So you can cancel you can make claims or cancel your trip for any reason at all under that sort of umbrella, if you will.
And I just want to clarify, when you return to LA, when you were in LAX, the only different protocol that you had to go through was filling out that 7-page form. Other than that, all the processes were the same.
So I fly into DC. I think I've flown into I've flown into DFW. I've flown internationally into a couple of stateside airports. The only thing, so you have to do that attestation form, that 7-page form. You have to do your test. Now, those are things that are required by the United States. The airline that you fly on might require different things as well. So they
So-
might require that you upload your test results to the airline. Does that make sense? Other airlines may not.
And then in transit, the only, like say the transit was in Singapore or whatever, the only things they would require upon entry to Singapore is the test results.
You'd have to check specifically for Singapore. Most of the airports that I've just transferred through and not like gone through customs and exited the airport, they have, so if you're going through Singapore, you're going to need to know the testing requirements to get through Singapore, connecting, and to get into India. You'll need to know both of those. Because
So
they very well could be two totally separate requirements.
even if you don't plan on stepping out of the Singapore airport, you're just there for 2-3 hours due to transit, they
Yep.
will still require to see test results.
It depends on the airport. Some
Okay.
of them, yeah, it depends on the country. Some of them do, some of them do not. Some of them say, as long as you've tested negative altogether and you're just passing through, we don't need anything. And then some of them say, stop you and say, you know, we need to see your test results. I've even been, I was trying to think of coming into Morocco, they had rapid tests. They were randomly pulling people aside for rapid tests upon arrival at the airport. So it's all different.
And to just familiarize yourself with the requirements of the airline. Say I'm flying Singapore Airlines to LAX to India, transit in Singapore, to know what the requirements upon entry and upon transit entry. Will I get some notification by email when I purchase a ticket, or is this research that I need to do on my own?
So the airline will send you the information regarding the airline, regarding their requirements. They may or may not send you information regarding transiting through Singapore Air or getting to India. So that's research that you need to do on your own.
And is it pretty much futile to print out a printed hard copy of your test results? Does everyone just basically want you to upload it online? Is it like not
For the US one, I would recommend printing it. Most of the ones I've been asked to hand over are printed ones. Everything else has been digital though.
okay? So there's no sense in like printing out a few copies of your negative results. Everyone's going to pretty much want a digital version of it.
I would do both.
Both? Okay.
Yeah, but my experience has been mostly digital.
Digital.
And
Yeah.
actually, Sam had popped in here too, that she does travel advising and consultation if you wanted to shoot her an email. So she is at sam@discoverwithsam.com. So I do need to move on because we're running out of time here. I appreciate all of the questions. I appreciate you guys attending today. I'd say, you know, let's be friends. You can find me at all of these different places at Global Debauchery. If you subscribe to my blog newsletter via pop-up or sidebar, you can get up to $100 off your next hotels.com stay. Again, let me go ahead and put my blog address in here. So you can also get $50 off an annual Wonderful membership forever using promo code Washington, DC. And let me go ahead and put that link as well.
Do hotels usually also require negative proof before you even enter it?
Some of them do.
Okay, just
It
to
depends
check
on
with
your-
them.
Yeah,
check
it
with them
depends on your
first.
hotel.
Okay.
And as well, I'm sad that Marinelle left because I had this up here for both Marinelle and I. So we are working together. She has put together this incredible award-winning women-led sustainable tourism program in Mongolia. And I am actually going to be traveling there in a couple of months to do content creation for them to sort of get the word out about what they're working on. And I'm looking to fundraise to get out there. So while they're covering my stay, my time is and efforts and talents and all the work I'll be doing is volunteer and free for them. We are hoping to raise funds, even if it's just $10 to get me out there so I can help highlight this incredible sustainable tourism program. And I did put the link in the chat as well. So if anyone would contribute to that, I would be forever grateful. And I'm sure Marinelle would as well. And don't forget as well, the next level session to this conversation, everything you need to know about international travel during COVID, that is happening Tuesday, June 7th from 1 to 2 p.m. Let me drop that link, all the links. And thank you guys so much for joining me. I hope to see everyone in the member portal.
Thank you so much.
You're welcome. I'll hang out here just for a little bit longer, just in case, but I hope everyone has a great day. And I hope I was able to answer a lot of your questions.
Thank you so much. Good session.
Thank you.